Our study shows that the health and healthcare needs of people that live in the same household are interconnected, and we think there's potential for service leads to make better use of household information when planning and providing care. Someone who's got multiple health conditions tends to use more health services than someone with fewer conditions, and that's as you'd expect. But we add to this by showing their use of health services also depends on the health of other people in their household. We use primary care data to count each person's long-term health conditions, and we link that to data from hospitals, community care and local authority social care so that we could quantify the use of those different kinds of services. And the local authority records contain a unique property reference number so that we were able to work out who lived in the same household, although the data were de-identified, so we weren't able to find individuals or specific addresses. We found that half of all people who had 2 or more long-term conditions were living with someone who also had 2 or more long-term conditions, and this fraction was even higher in the most deprived areas. In households where both residents have multiple conditions, we found people had higher annual primary care costs, more GP visits, and were more likely to use community care. Our work suggests we might be able to better connect health service input across household members. For example, we may be able to tailor the kind of care that's provided so that it includes clinical input and also encourages peer support within a household. Or we could make care more efficient if providers could schedule care at the household level. We know this happens sometimes, but think there's scope to do it more systematically. And finally, this work reaffirms the need to identify and support informal carers. Many of them could be managing their own complex needs, as well as the complex needs of their co-residents.